This is Rural Health Leadership Radio.
Episode 167, a conversation with Dr. Matt Dalstrom, professor at St. Mary's College of Nursing.
If you're able to get them out into the community, you're able to kind of build this personal connection and empathy with patients that, will improve overall patient care.
Welcome to the Rural Health Leadership Radio with your host, Dr. Bill Oxier. Each week, Dr. Oxier has a conversation with a different rural health leader to discuss what's working and what's not working in rural health, along with other topics of interest to rural health leaders. Rural Health Leadership Radio's goal is to improve health in rural America by providing a simple, no-cost means to share information and connect rural health leaders from around the country. And now, here's Dr. Oxier with today's guest.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to Rural Health Leadership Radio. I would like to thank Bill Oxier Healthcare Executive Coaching for underwriting the cost of today's episode. But more importantly, I want to thank today's guest, Dr. Matt Dalstrom, for taking time out of his busy schedule to have a conversation with us today. Welcome to Rural Health Leadership Radio, Matt.
Thanks so much for having me, Bill.
Matt Dalstrom, PhD, is a professor at St. Anthony College of Nursing in Rockford, Illinois. So, Matt, tell us about yourself. Who is Dr. Matt Dalstrom? What's your story?
Well, as you said, I'm a faculty member at St. Anthony College of Nursing, and we're a small, single-purpose nursing college affiliated with OSF Healthcare. And in my role at the college, I teach public health and social justice courses to graduate nursing students. And in addition to that, I work very closely with helping develop community-based DMP projects with the students that really kind of range from addressing a wide array of health problems such as access to care for the homelessness to bullying in schools, childhood obesity programs, things such as that. And I'm not clinical, so one of my really big focus points is teaching students how to build connections and work collaboratively, with community members. Because I really kind of believe that healthcare, so often we don't really get that input from the community as to what their needs are. And so I love getting these, future leaders of nursing out into the community, working with community members, being collaborative. And then also, I think so much that, it's really hard to understand patients if you just stay in an office all day long. And if you're able to get them out into the community, you're able to kind of build this personal connection and empathy with patients that, will improve overall patient care. And so that's really what I focus in on, is kind of getting students out in the community and working with the populations.
I would think it certainly helps them see the bigger picture, that's for sure.
It really does. It really does. I think that, when you come from a particular background, whatever your background is, and you see patients from a whole litany of different backgrounds. And if you've never been to their house or to their neighborhood, you don't really fully understand the challenges that those patients, face. And I think it's so important to be able to know that and to be able to understand that, so you really can provide the best quality care for them.
Absolutely. So, Matt, why did you choose healthcare as an occupation?
Well, I knew really early on that I wanted to go into academics, and I wasn't really entirely sure, what I wanted to do. But one thing that always kind of fascinated me is that my grandmother grew up in the Appalachian Mountains. Okay. And my mother too. And they always had some folk remedy for something. And I always thought, hey, that's pretty cool, but I didn't really know you could do very much with it. And so when I went to school at the University of Georgia, I kind of started taking courses in folk medicine. And I thought that was really, really interesting. I was like, oh, wow, maybe you can get a job doing this. And then as I kind of evolved through that thinking, I began to think more and more about, healthcare as a fundamental human right. And once I kind of latched onto that idea, I knew that that's what I really wanted to do.
Very interesting. And I'm sure we could talk for hours about that, the home remedies on things. I bet you got some interesting stories to share there, but that's another episode and another conversation. So why did you decide to focus on rural health in your research?
Well, I think, part of this is, my upbringing. As I said, my mother grew up in the Appalachian Mountains of East Tennessee, and my dad grew up in northern Alabama, rural northern Alabama. I grew up in small town in Georgia. And so I've always just felt very comfortable and enjoyed, rural settings. Then when I went to school, I was at Mississippi State University in Starkville, which is a pretty rural area. And then kind of serendipitously, when I took my job here at the college, although we're in Rockford, Illinois, which is one of the largest cities in Illinois, we are surrounded by rural counties. And so it was a very easy transition to kind of take, what I was comfortable with and where I liked working and be able to apply it to my professional career.
That makes sense. Thanks for sharing that journey with us. As you know,
Sure.
Matt, the name of this program is Rural Health Leadership Radio, and I emphasize leadership. What's your definition of leadership?
When I think so much about leadership, I really think about one of my earlier mentors. And what I really kind of loved about him so much is that he was able to provide a vision for you, but then also for a vision for where we needed to go. And he was able to use that vision, articulate it well, and then use that to inspire you to work harder, strive harder, and do more things. Well, the vision was only part of it. He also worked very hard to give me the tools, the support, and the trust, trusting me that I could do it, that kind of hands-off approach. And I've always kind of felt like that is the ideal leader for me. There's someone that can inspire you to work, give you the vision, the template in which to work in, and then provide you with the tools to be able to really kind of attain those goals.
Yeah, I like that definition, especially the fact that, you put that under the umbrella of a mentor that had obviously an influence on you, because mentoring is so powerful, not only to be the mentor, but to be the mentee, right? Both ways.
Oh, it really is.
Yeah. So thank you. I appreciate that definition. So you are the first medical anthropologist in my knowledge that I've ever met. So it's nice to meet you, but what the heck is a medical anthropologist?
Well, first of all, hopefully I'm not the last medical anthropologist that you meet.
Yes.
Medical anthropology is a subfield of anthropology. Probably the most well-known subfield of anthropology is archaeology.
Okay.
Or forensic anthropology. So if you ever watch the TV show Bones.
Yes.
I'm not either one of those, although quite frequently I get confused.
Okay.
With that. But basically, a medical anthropologist focuses on how social and cultural factors are influenced by or influence health or healthcare. For instance, we really might look at, maybe how health beliefs are shaped by Medicaid policy, previous encounters that patients had, with the healthcare system, and access to care. And so really it's taking the approach is a very holistic approach, and we're trying to, kind of understand the situation, the problem, and in particular health, really from the patient's viewpoint or the patient's standpoint. And so this is very different from a public health perspective, which is kind of this, kind of like looking down, aggregate, the big picture type thing. For a medical anthropologist, really trying to kind of understand that interaction between culture and societal factors.
Very interesting. Very interesting. That's and so, what you were talking to earlier, how you help students get out into the community. I mean, so that's very much a part of what medical anthropology is, and understanding the social norms, the cultural values, and all that sort of thing, right?
Exactly. And so that's so much of what I really kind of strive for in the way that I educate, my students. It's more than just being, culturally competent. Is a term that we throw around in healthcare a whole lot.
Yes.
But it's really kind of learning how to interact with individuals. And, the way that you're able to do that it's very simplistic. It's by talking to individuals,
right,
seeing what their lives are like, trying to figure out what their viewpoint is, their problems, their successes, their failures, or whatever it is that it might be. And that helps you kind of understand how they go about accessing treatment, how they go about interpreting what it is that you say when you diagnose them with something.
Yeah, so I mean, obviously that plays into an individual's worldview to a great extent, I would think, how they see the world and what their core values are. Because I do hear, I've had guests on the program here talk about providing culturally sensitive healthcare, which is good and which is a part of this, but this is much more than that, right? Right.
This would be much more than knowing the whether or not you should shake somebody's hand, or knowing more than whether or not, there's eye contact, right? Yeah. It's really trying to get that in-depth understanding. We call it the EMIC, so that kind of insider viewpoint of the particular situation. And that's a little bit deeper than what we're talking about with being, culturally sensitive.
Sure. Very interesting. Thank you for sharing that with us. So I know you've done a lot of studies in your career. One that you did was on cross-border medical travel. Can you give us an overview of that study?
Sure. So I started my work on cross-border medical travel a little over 10 years ago now. And I began it by, we can kind of give you a backstory. So cross-border medical travel entails people traveling from one country to another country to access healthcare. And you might do that for a wide variety of different reasons. Primarily, we talk about it in terms of cost savings, but it could be more culturally appropriate care, kind of follow it up on that piece.
Yes.
It could be issues of just basic access or barriers or things like that. And so I was very interested about cross-border healthcare between the United States and Mexico. And so I first started out by moving down to McAllen, Texas, and interviewing Mexican doctors and nurses and pharmacists. And I also traveled with people as they went from the United States over into to Mexico to get healthcare. One of these things that always kind of stuck with me is whenever I kind of talk about this, the first question anybody ever asks me is it safe? And that was the first question by and large.
Sure.
And so I really wanted to begin to kind of explore that issue of safety. And so I decided to focus upon winter Texans. Winter Texans are retirees who spend at least 1 month living in Texas during the winter. So you might think of them also as snowbirds if you were going to be in Arizona or we go down to the border.
Florida. In Florida, we have lots of snowbirds here. So, yes.
And you know what? Living up here in the Midwest, I totally understand it.
Yes.
And so they go down there and they stay essentially in, RV parks. And a fair amount of them cross the border into Mexico for healthcare. And so I reached out to the University of Texas, Rio Grande Valley, and they maintain a Winter Texan panel. So basically a survey or list of Winter Texans who have agreed to participate in research studies. And we sent out a survey to a little over 1,000 of them, asking them about their medical conditions, usage of Mexican healthcare, health-related quality of life, things such as that. We received about a little over 300 people responded. And then of those 300 people, we sorted them out and then did follow-up interviews, phone interviews, with 13 of them. Winter Texans have always been a really wonderful population to work with, and they've always been very generous with their time.
Yeah, that's pretty cool. So how in the heck did you get interested in studying cross-border medical travel? I'll take a sidebar here before we keep talking about this.
Sure. So I was in graduate school in Mississippi State University, and I was still kind of on my non-vitamin, non-mineral supplement, phase of my career. Very interested in that kind of, that folk medicine stuff,
yes,
or partly folk medicine stuff. And so I was interviewing some nurses over at a local health system. So this would have been back maybe in like 2005-ish. Okay. And they told me that their health system could no longer afford to carry dental for them. And so what they were doing once a year is they were taking their families and they were driving them down to Mexico to get all of their dental care. And I thought that was the most tragic thing that I had heard up to that point in time, that the people who are taking care of me aren't even provided with the health care that they need. And that's what really kind of got me started with this, whole idea of cross-border, medical travel, because it was really kind of rooted in the idea that some people just do not have access. And this is one of these kind of more creative ways they go about trying to access care.
Yeah, very interesting. And so the curiosity took over, it sounds like.
Completely took over.
All right. So what were some of the key findings from your study, Matt?
Well, the first thing that wasn't particularly surprising to me, but was that over 50% of our participants had purchased medication in Mexico over the past year.
Really?
Really. And they were purchasing stuff for things such as infections, diabetes, hypertension, erectile dysfunction, arthritis. So they're really kind of purchasing it for a really kind of a wide gamut of health conditions. And about 92% of them said that the medication they were purchasing worked just as well as what they were buying in the United States. And as I said earlier, we were really interested in this idea of risk. And so we asked people whether or not they had experienced an adverse drug event in the past 6 months. And what we found was that purchasing medication in Mexico didn't increase the amount of adverse drug events. And in actuality, more of our participants who were just using medicine purchased in the U.S. had adverse drug events. So we thought that was kind of interesting.
Very.
And we also noticed that usage of Mexican medicine didn't impact health-related quality of life scores. Health-related quality of life scores can be used as a proxy for how well diseases are managed, and we didn't see any differences within it, which would suggest that people are very able to effectively manage their health care using Mexican pharmaceuticals. And it's important to kind of note, take a little quick sidestep, is that when you purchase medication in Mexico, most of the medication that you can purchase without a prescription.
Really?
And you can bring that, yes, without a prescription. And, there's a few different things like narcotics or whatever you need a prescription for. But by and large, you can do it. And then you can bring back up to a 90-day supply back to the United States at the same time. So that's kind of an important thing to mention. And then we also noticed that people were engaged in some very elaborate, say, like risk management strategies. So, the first thing that they would do is they would always evaluate the pharmacy that they were going to. And they would do that based upon aesthetics. But then also, most people would only go to pharmacies who they were recommended to go to. And then when they would start going to those pharmacies, they would work really hard to develop these very deep, long-term trusting relationships with certain pharmacists. And so they would only purchase from that pharmacy and then only purchase from that pharmacist. We also found that over half the participants were also talking to their PCP in the U.S. and asking, hey, is it okay? Or letting their PCP know that they were doing it. And probably the most interesting piece was that, some individuals where after they were started using the medication would come back to the U.S. or go back home up in the Midwest or wherever they were, and they would increase the amount of screening tests that they had. So if you were trying to manage your cholesterol, and so you bought a bunch of cholesterol medication in Mexico, well, you might come back to the U.S. and get your cholesterol checked three times a year just to make sure it's actually working, as opposed to what your provider might normally recommend.
You want to make sure the drug you bought is doing what it's supposed to do, right?
Well, but talk about that, like really kind of engaged patient to be able to do each and every one of these things.
Exactly. That's pretty interesting. And the fact that, the stories we hear in the press and everything are always about adverse effects. And you're saying that it was actually less than the norm here in the States. So that's quite interesting. Were there any big surprises for you?
Well, I think there were two things I found kind of surprising. And the first one is that individuals who purchased medication in Mexico were much more likely to take their medication as prescribed and were less likely to report missing a dose. So they were slightly more adherent. And then we also found, and this totally blew my mind away, was that, some medications like in the US are combination drugs like Vytorin, but you can't buy the combination drug in Mexico. So what people were doing were buying the individual components of the combination drug in Mexico. And I thought, that once again kind of speaks to a certain level of savvy, knowledgeable patient consumer.
Yeah, much more informed than is typical, that's for sure.
And when we asked them about knowledge, people who used healthcare in Mexico did report they had a higher level of knowledge than those that didn't.
Yeah, knowledge and informed, engaged. It sounds like a lot of benefits, actually, that's my big surprise from what you're telling me. Because like I said, on the news, all we hear about are the negative stories that come through, it seems like, anyway. So,
well, right.
What can a rural health leader take away from this research that you did here?
Well, I think first and foremost, in 2016, the Kaiser Family Foundation published the results of a survey, and they found that about 8% of the U.S. population are purchasing their medications abroad. And if you look along the U.S.-Mexico border, other studies have shown that up to 50% of winter Texans, just like our study, buy their medications abroad, but other border residents too, up to about 40%, buy their medications abroad. So, the first part is just kind of knowing that that's out there. And a vast majority of our participants were from rural counties. So that kind of speaks to that issue.
Yeah, it does.
But I think that, what's more important to me, or what I would say is much more of a takeaway, is that research like this really kind of helps us understand, how healthcare decisions are made. And that for the majority of these people, these were community decisions, not individual decisions, especially when we're talking about older adults. And so we think about issues of patient education. There is a certain utility in educating the community, because the community was providing the referrals for the medication, providing referrals for which pharmacy to go to. So that was it's kind of a very important component to it. And I think what's also important as a kind of takeaway is this idea of how healthcare is delivered. I mean, it's pretty amazing to think that you might travel 1,000 miles to the border and then cross and then go to a small pharmacy located really kind of away from everything else, or to a small dental clinic, or to a small doctor's office. And so the question then you have to ask yourself is, well, what are those providers doing that are drawing people from all over the country, to them? And they're doing, a couple of things. One, they're providing, easy access, and, you don't have to make appointments per se, and they're close to other things. But, they also have very clear and transparent pricing. So you know exactly what you're paying for before you even, go to do it. And I think that in a lot of ways, this process, really kind of empowers, patients. So I talked about this idea of knowledge, and the patients seem to be very knowledgeable.
Yes.
But the way this works is that I think that through talking with their PCP in the U.S. and then them looking abroad, it's really kind of fostering this knowledge and patient engagement piece, to it. And so I kind of think about, well, how could we maybe deliver healthcare in such a way here to really kind of promote that patient engagement piece? And so I think there's like these different touch points of how patient care is delivered in this kind of setting that can be applied to, rural health systems.
Yeah, that's some excellent points, man. You're making me think about things I'd never thought about before, Matt. So that's cool. I love that. Lots of lessons to take away from that. That's for sure. You've seen a lot of things both in the U.S. and in Mexico when it comes to healthcare. What scares you the most about the future of rural healthcare?
Well, I think what really kind of scares me the most is, clinics closing, and especially those independently owned rural pharmacies, closing.
Yes.
And, kind of creating these gaps, right, in terms of care and access to, very basic things such as, pharmaceuticals.
Yes, that is scary. That's for sure. So in light of that, let me flip that question around to ask you, what excites you the most about the future of rural healthcare?
Well, I think what excites me the most is one of the reasons why I like working in rural healthcare so much, is that a lot of rural hospitals or rural health systems, they're smaller. And so they're a little bit more nimble, and they can really kind of try and experiment with these new types of models of like patient care and delivery and engagement in a way that some of these larger health systems just can't do, because the bureaucracy and the size just makes it very prohibitive. So I think about rural health, and I think about opportunities for change, opportunities for new models of care. And I think that's just really exciting to think about.
Absolutely. What an incubator for innovation, that's for sure. Matt, we've talked about a lot of different things here in the short time we've been talking together. If our listeners only take one thing away from the conversation, what should that be?
Well, that's a really good question. Well, I think that when we talk about this idea of, barriers to care, and people all around the country face different, barriers to care, I think we should also take a look at the kind of creative solutions that people have to try to access care, to get around those barriers. I mean, going to Mexico is a way to get around health insurance barriers, to get around financial barriers, to get around, even having to see your doctor. So there's kind of this creative solution. I think if we kind of look at these creative solutions, we can think about, one, we can talk about risk management. What are people doing that might be risky? But then we can maybe begin to also ask ourselves, well, what can we learn about those kind of creative workarounds? Is that something that we might be able to implement in our health system, or take a look at, or think about our care, delivering it in maybe the way that people are actually using it?
Dr. Matt Dalstrom, professor at St. Anthony College of Nursing in Rockford, Illinois. Thank you again for joining us today here on Rural Health Leadership Radio.
Well, thank you so much for having me.
Man, you really blew my mind a little bit with the study that you did and the results that you found. So thank you for that. Hopefully you have the same effect on
You're
our
welcome.
listeners, getting some of those innovative juices going. So thank you for that. And I want to thank all of you out there for listening today. If you enjoyed today's episode, please go to iTunes, Stitcher, Google Play, whatever your favorite podcast app might be, and subscribe to Rural Health Leadership Radio. Until next week, let's keep working to improve rural health, one conversation at a time.
If you would like to connect with today's guest, please send an email with your contact information to bill@billoxier.com. If you would like to be a guest or suggest someone else as a guest, have a question you would like to ask, or simply want to contact Rural Health Leadership Radio, please use that same email address, bill@billoxier.com. That's BILL@BILLAUXIER.com. You can also visit our website at www.rhlradio.com.
And we'd ask that you please support our sponsor, the Dynamic Leadership Academy for Rural Health. The Dynamic Leadership Academy for Rural Health's mission is to improve rural health, one leader at a time.